1999 to 2016, more than 350,000 people died, with an estimated 91 Americans per day to lose their lives to this problem. Secondarily, illegal abuse counts for nearly 50% of incarcerations, and yet the CDC estimates that 92 million people take them every day. The victims are numerous, but the urgency to take action has been slow. If this were an infectious, highly contagious disease contributing to these death rates, we would be scrambling to find a cure or answer to the problem. So why aren't we frantically searching for the solution? This is an epidemic that has been on the rise since the 1990s, but the threat that it carries modern day is like nothing we've ever seen before. This epidemic I'm referring to is the opioid crisis. Opioids are used medically for pain relief. These medications bind to the areas of the brain that control pain and emotions, driving up levels of dopamine, or the feel-good hormone, in the brain's reward center, producing an intense feeling of euphoria. This can very easily lead to opioid use disorder, or OUD, which includes the misuse of prescribed opioids, the use of non-prescribed opioids, and the use of illegally manufactured or obtained heroin. OUD is typically a chronic, recurring illness associated with high rates of mortality and morbidity. The opioid pandemic began with its first wave in the 1990s with an increase in opioid prescriptions after pharmaceutical companies had reassured everyone that treatment with opioids was safe, effective, and not addictive. In 1993, Dr. Russell Portnoy, a pain specialist in New York State, stated, "There is a growing literature that these drugs can be used for a long time with few side effects, and that addiction and abuse are not a problem." The results were far from this, with a sharp increase in opioid-related overdose deaths. The second wave hit in 2010 with a large increase in overdose deaths involving heroin. And the third wave began in 2013 with an increase in deaths involving synthetic opioids. There is no clear one-size-fits-all solution to the epidemic, but doing nothing will result in a public health crisis with increased spread of infectious disease, including hepatitis C and HIV, increased opioid overdose deaths, and opioid misuse. There are strategies for clinicians to prevent prescription drug misuse and its consequences by utilizing alternative treatments, establishing a treatment plan, and limiting doses and early refills. One of the first principles to prevention is reducing the number of patients that are reliant on controlled substances. This lies in the hands of the doctors prescribing these opioids. Narcan has been proven to be safe and successful in stopping 93% of overdoses, according to research presented at the American College of Emergency Physicians annual conference. But placing the antidote for reversal of overdose into an addict's hands is not the answer. Narcan should be carried by all emergency responders to administer in case of emergency, but kept in the hands of those professionals so that they can monitor the patients and know how to handle any adverse reactions or administer more Narcan if needed. Because they are being treated at a medical facility under medical professionals, they can then help the addict seek long-term help. Those diagnosed with OUD have much higher rates of abstinence through medically managed withdrawal programs and are medicated long-term to prevent relapse. Addiction is a chronic illness, similar to long-term care for routine medical problems such as hypertension, diabetes, and asthma. We must provide ongoing care to patients with the disease of addiction. Addiction to opioids doesn't discriminate. Next, it could be your neighbor, your father, daughter, or friend. President Trump has declared the opioid crisis a state of emergency that must be acted on now, saying, in quote, "It is a serious problem, the likes of which we have never had before. The time to act is now."